My name is Dr. Maya Assi. I'm a real biological dentist, and I live in Florida. As a real biodentist, the most surprising discovery I made during my program was really being able to connect the nutritional aspect to the oral health. This is something that you rarely get training in as a dentist anyways, and even in the other holistic and biological programs that I went through, there was never a mention of the impact or how to identify ways that we can better optimize our patients through proper nutrition for the better outcome of the dental treatment that they're going to receive. The Academy has enhanced the way that I look at the connection between oral health and overall health, in making sure that we understood the concepts of nutrition down to the micronutrients and how that plays a role, bringing it back to the oral cavity and the oral health. A specific case where what I learned as a real B allowed me to change a patient's outcome was when I was able to help my patients optimize in their healing through just making them mindful of what they're doing with their daily habits, especially their nutrition. Seeing the difference in post-op care in surgery because the patient was more mindful, staying away from, core 4 or inflammatory foods, following through with the bone healing protocol, and being able to see them go through some very significant surgeries and heal much better as a result. Being a real B stands out as opposed to a traditional dentist because now we're focused on not only being an architect of the mouth, we're focused on being a physician of the mouth and a physician of the rest of the body, being able to constantly tie in the mouth-body connections while disturbing the biological terrain negatively as least as possible, and always thinking how we can optimize the health for longevity in the patient's future. This certification has enhanced my practice's ability to reach to the patients on a completely different level, where we are not going straight into their teeth. We are first evaluating what they have going on as far as their nutrition, and that creates an overall better relationship between us and the patient and has allowed us to really be able to take care of them comprehensively or holistically. One thing that I can do now as a real B that I couldn't do before is write a nutritional plan for the patient, which would allow them to optimize their healing and maybe even allow them to optimize their life in general. The VIP day in Germany was out of this world. I cannot describe the experience in better words, but I'm going to try. The entire team here at the clinic is open, happy, ready to help, ready to share. Dr. Dome himself is extremely approachable, open to sharing everything that he's curated over the past many, many years with us. You feel like you're building friendships and relationships. It's not only transactional, it's very emotional, holistic. The patients are happy to share. And it definitely kind of brings everything full circle from at first learning the curriculum online to then being able to have these Zoom calls and meet your other group members, and then being on a WhatsApp where you can bounce ideas off of each other, and then coming full circle where you're here and you're seeing everything the way that you were taught, the way that everybody's talking about in the group firsthand, and being able to see how it's really done and the team approach that it takes was really kind of tying everything together. So the VIP experience is a must, in my opinion. It really puts things into perspective, and I am so excited to go back to my clinic. I'm so excited to bring back what I've learned. And I feel a security and a confidence of a friendship and a mentorship that I know is solid in science, solid in background, solid in effortless precision performance. And I'm just very, very happy that I made the decision to come. Listen, as a mother of 3 children and a practice owner myself, I can understand sometimes where it can be difficult to get away, to make the trip, to come, to dedicate the time. But I can absolutely assure you that it was worth every single, logistic planning or time off that was required in order for me to get here and spend the 2 days with Dr. Dome and his entire team. Learning biodentistry as a real bee has allowed me to tackle challenges that traditional dentistry didn't allow me to, because now I'm really zeroing in on focusing on what the patient is doing on their day-to-day. What is the patient doing when they're away? How can I explain to the patient that, their gut is related to their mouth, and people who are healthier heal better? It has helped me get better results because it has allowed me to build a relationship with my patients where they know that they have ownership of their healing as well. So it's not just what I'm doing to the patient, it is a true partnership. The patient understands, we take time to explain to the patient, the bone healing protocol. Why is the bone healing protocol important in order for them to optimize the way that they heal? It's not just what I'm doing to them, it's what they're bringing to the table in terms of their health, what they're incorporating into their body to allow what I do to them or what my team provides to them to allow better healing. So it's really been more of a let's hold hands and get in a partnership together. And it's a little bit what I do and it's a little bit what you do. And together we can get really good results. So one of the misconceptions about biodentistry, I think more to the general public, which this program has helped me solidify, is that everything really is based in science. Like every module that we learn has lists and lists of research-based articles where Dr. Dome has been able to, get his information and deliver it to us in a way that makes 100% scientific sense. It's not, it's not woo-woo dentistry. It's not voodoo dentistry. It's science-based, evidence-based dentistry, and it's backed with articles upon articles of research and also of patient experiences and outcomes. So that kind of it totally gives you more confidence when you're speaking to the patient, or if you're speaking to other people about biodentistry, to say, this is proven, and you can go here and you can read this and you can learn for yourself. So definitely the evidence-based research backing what we're learning is a big plus for sure. The knowledge of real bees is not just influencing the future of dentistry, it is the future of dentistry. Patients are much more aware of their health. Patients are doing their own research. And when they do, they're coming to the understanding that the mouth is the body. And they're seeking practitioners and dentists and physicians that are going to help them make those connections, remove those interferences safely, reconstruct their dentition with the least harmful effect to the biological terrain, the least toxic materials. And so biodentistry, this is the future of dentistry. It is not just influencing dentistry. It is now, and it is here to stay. And it is definitely, the dentistry of the future. The program helps because it solidifies the knowledge. It brings in new knowledge that you didn't even think about. And it also gives you a community of dentists who are in the forefront, who are threading the way moving forward. And to be part of a group of so many, knowledgeable, caring individuals who are dedicating their life's profession to helping other people detoxify their lives and optimize their health is just really, I think it's a privilege to be part of such a group, for real. So within the practice and the community, I plan on sharing this knowledge with anybody who will listen. There are many people who are asking. One thing that I'm doing in my practice. One thing that I'm doing in my practice is, giving out little bits of wisdom on my social media, and I'm also getting out in the community, and I'm accepting invitations to speak on the topic of biodentistry. So not only the patients are aware, the other doctors who, have kind of like they've heard from the patients, they're doing their own research for whatever has happened to them in their own health, kind of spreading the word. And when they ask, okay, I'm ready to learn, where do I start? After me having gone personally through many different associations, which are great, I think I would have fast-tracked my education if I had started here first. So I would definitely guide them towards, the real B's and the certification. And I think also the patients can also learn a little bit too. So I would definitely direct them here first. Contributing to the larger vision that Dr. Dome is pioneering is being there to share our knowledge with anybody who is willing to listen, with anybody who asks, and directing them in the proper way so that they can get the proper education and a great base of education to move forward to treat patients. And also, sharing with each other. We are not in competition with each other. We are here to solve a problem with each other for multiple patients. So being able to tell my neighbor or, the dentist in the meeting that wants to learn about this program is basically bettering the profession, and it's bettering all of the patients that are seeking this type of treatment. So just sharing with anybody who asks or anybody who's willing to listen, and being available and open-minded to anything that the future brings, a meetup, and maybe a symposium for the real B's. Why not? Being involved as much as is needed, being open to be involved as much as is needed, I think definitely will probably catapult the vision to the future. And sharing this program, don't keep it a secret. Share it with people who want to learn. Direct them this way will be better for people. I think the whole world to really understand biodentistry the proper way. I mean, I think I've summed it up. It was an absolutely, best decision, best money spent, best time invested. And I look forward. It's so excited for the future because I know that more and more this is evolving, and there's definitely more of a community to come. I'm thinking of many words that can sum up what being part of the Real Bees has done for me. But because I have to choose one, I'm going to choose competence. The feeling of being competent to give you confidence to be able to deliver the proper care to the patients. And so I would say competence.